Good morning, everyone, and thank you for joining me today. Over the past few months, our government has achieved significant milestones in our work to refocus Alberta's healthcare system. Every day, we are getting closer to our vision of providing better healthcare to all Albertans, regardless of where they live in our province. Today marks another milestone as we introduce amendments to legislation through the Health Statutes Amendment Act 2025 to address several outstanding refocusing policy items. So these amendments will ensure that all components of the healthcare system can fully transition to our refocused healthcare system, a system that Albertans have helped build by sharing their expertise, their feedback, their experiences, and their insight. I'd like to take a moment to personally thank the many dedicated and passionate Albertans who have joined us for our public engagement sessions. We have finished our second round of engagements with another 65 sessions held across the province, where passionate Albertans have informed what a refocused healthcare system looks like to them. And I am extremely grateful for their contributions. Many of these individuals are healthcare professionals, and it's just been extraordinary to see the number of people who have come out to take part in these sessions. A major topic of discussion was how to position public health within the refocused system to sustain its critical functions and enhance consistency and coordination. So through amendments to the Public Health Act, we clarify health's role within our refocused healthcare system and address a key question raised during the engagement sessions. Public health will be moved out of Alberta Health Services, strengthening public health's role in protecting the well-being of all Albertans and allowing AHS to focus on delivering acute care services. Primary Care Alberta will deliver public health prevention and wellness programs aimed at empowering Albertans to reduce health risks. This includes frontline public health services such as communicable disease control, immunizations, newborn screening, and health promotion. Key functions like policy development and public health inspections and surveillance will transition to Alberta Health, as will the province's medical officers of health. There will be no disruption to public health functions and activities while this work is underway, and Albertans will continue to access public health services as they always have. Additionally, the Health Statutes Amendment Act 2025 includes proposed amendments to the Provincial Health Agencies Act and would repeal portions of the Hospitals Act. The Hospitals Act is an outdated piece of legislation that does not reflect current acute care system governance or the introduction of new governance structures and ministerial roles. So repositioning the portion of the Act that governs hospitals and integrating it into the Provincial Health Agencies Act will ensure governance of the health system, that governance is under one statute, and that the legislation accurately reflects how hospitals will be managed and operated within the refocused healthcare system. Furthermore, amendments to the Provincial Health Agencies Act will enable the new Health Shared Services entity, which supports all four of our health services sectors, to provide oversight for health foundations in the refocused system. This is a natural fit as foundations work across all the sectors and will establish a clearer connection between the health foundation and the communities that they actually serve. Amendments to the Protection of Persons in Care Act will also provide additional capacity to complete investigations into allegations of abuse. This reflects our government's ongoing commitment to providing timely service and protecting vulnerable Albertans in care. And finally, the Health Information Act is being amended to grant the Ministry of Seniors and Community Social Services additional powers to fulfill its mandate as a sector ministry for continuing care. In November of 2023, we announced that we would be refocusing the healthcare system, and today we are happy to share that we are in the final stages of operationalizing that vision. Through the Health Statutes Amendment Act 2025, we are demonstrating our commitment to achieving this goal and are honoring the dedication of the many Albertans who have walked alongside us throughout this whole process. Very soon, all Albertans will have access to the health care they deserve when and where they need it. So thank you all for coming out, and I look forward to your questions.
Okay, thank you, Minister. We'll now open it up to questions from the media. Just a reminder for those in the room and on the phones that this press conference and information shared regarding the legislation are under embargo until the legislation is tabled today. As always, if you could please state your name and outlet, and we will be sticking to one question, one follow-up. We'll start here in the room before moving to the phones. We'll start with Janet and then go to Catherine.
So, Minister, just regarding the plan to move public health functions to these two other entities, to review, your government fired one chief medical officer of health for acting on government decisions, then fired her again from Alberta Health Services. Your most recent chief medical officer of health refused to continue on, and then later said there was a failure of leadership in managing the measles outbreak. And then you paid millions of dollars for these health policy reports that actual scientists say are full of evidence-free information. So I guess I'm wondering, why should the public entrust Alberta Health and your ministry with all of these functions?
Well, currently the MOHs, which are the medical officers of health within public health that reside within Alberta Health Services, report up to the CMOH within my department. And in between that, there are CMOHs within Alberta Health Services. And what we're really looking to do is make sure that that is streamlined. Alberta Health Services, as an acute care provider, will not be in charge of all of the agencies. They are going to be an acute care provider. Public health transcends all of the agencies, all of the pillars of health. Recovery Alberta, Primary Care Alberta, Assisted Living Alberta, and of course acute care Alberta. So we need to have public health. The policy side needs to reside within government because that's where it does reside under the CMOH. These MOHs are supposed to be reporting up and do report up to the CMOH currently through legislation. And this will streamline that process. And the frontline staff will be within primary care, where we're really going to take a more concerted effort to make sure that we have more concentration on public health in terms of how do we do more preventative and information sharing across the whole province in public health. So really it's a natural fit.
What credible healthcare worker or physician is going to want to work directly for a government that did all those things I've just listed?
We are continuing to work with all of our MOHs who have been working diligently. I think it mischaracterizes the good work that's already been going on by all of our medical officers of health and our chief medical officer of health. When Dr. Jaffe was in the role, he continued to work very closely with those MOHs, whether it was measles, whether it's influenza, whether it's any of the myriad of other things that we cover through public health, and that's going to continue. And in fact, I think it will be further enhanced because it will all reside under one area.
And so this public health inspections and surveillance is under Alberta Health, but things like immunization programs are under Primary Care Alberta. I'm wondering why not that arm's length?
The policy is under Alberta Health, as it currently is. The actual on the ground delivery will be under Primary Care Alberta. So the nurses, the healthcare nurses, et cetera, healthcare practitioners who provide those services will be under Primary Care Alberta because they're dealing directly with the public. And then as far as the policy, the back of the room pieces, that is within Alberta Health.
And there's several unions that have been undergoing bargaining negotiations at the same time as you're doing this restructuring. So what is going to happen with bargaining? What's going to happen with the unions who will be affected by these changes?
Well, as we've gone through this for a year and a half almost with the refocusing, we have had to deal with that situation that you have said because we've been bargaining with every healthcare professional in the province, healthcare professional union in the province, and that will continue. We have a process in place that we have to follow, and so we're going to continue to make sure that that is followed. We'll follow our collective bargaining. We will make sure that we connect with the unions, that we we continue to have those discussions with the affected practitioners, the affected healthcare providers, and we're going to continue to do that process. We've done it already for 3 agencies, and we're going to continue to move that forward.
Hi, Cindy Tran with the Edmonton Journal. You mentioned the new health shared services entity. I'm just wondering, has this been established, and if not, when will it be stood up? Because I don't know.
Well, we announced it not too long ago. It will reside, we did announce it a little while ago. We anticipate having it stood up here in the summer and fully stood up. So this will then follow as we stand that up, that the foundations will fall under the shared facilities. So that work is ongoing right now between all of the agencies that are affected, which are all 4 of the pillars that we have, which I've already mentioned: acute care, primary care, Recovery Alberta, and Assisted Living Alberta. So they all sit at the table together, and we're working through what that looks like.
Okay, so then when it says here, that entity is going to support all 4 health services sectors, what would that look like? What does that kind of support look like for these?
Well, if I can give you an example right now. So right now, Alberta Health Services looks after a lot of the administrative behind-the-scenes HR type functions. How does that then transition under shared services? What is affected? Alberta Health Services has a shared agreement, a shared services agreement with Covenant Health. So now that will also transition over to the shared services. So it's just a lot of the behind-the-scenes mechanics, if I could say it that way, that work to make sure that there's an integration and that all of the provincial agencies have the ability to, have the economies of scale and be able to work effectively together.
Leo from City News. Now you mentioned there's 4 pillars now for the public health, of course, the primary, acute, the recovery addiction, and the assisted living. That's one of your refocusing of healthcare system. Has there been improvements of separating those and focusing on each pillars of the health sector?
Yes, and each pillar could probably share some of the improvements that they're seeing and the ability to have that focused attention on, say, primary care or Recovery Care Alberta. I look at the fact that we've been able to increase the number of doctors we have, increase the number of nurses, increase the number of healthcare aides. When we look at the work that's being done in post-secondary to increase our seats, also the work that we're doing to streamline processes to get international medical graduates back to Alberta, whether they were Alberta students that went out and are foreign trained and now come back, as well as others that are coming from other countries that were trained elsewhere. When we look at Recovery Alberta, they initially started with roughly about, it was mental health and addictions, they roughly had about a $50 million budget. And when we looked at transitioning it out of Alberta Health Services, AHS, they had an additional roughly about $700, almost $800 million. Now their budget is $1.4 billion and climbing because we are able to identify the gaps in service delivery that we have seen as we moved Recovery Alberta, those mental health and addiction functions out of Alberta Health Services to a focused area called Recovery Alberta. And we're seeing that in Primary Care Alberta as well. We're looking at the FAST program, which is the Facilitated Access to Specialized Treatment. How can we make improvements in that? How can we get the referral system working better? How do we get people into the queue for surgeries much quicker? So there's a lot of focused attention as it's transitioned from Alberta Health Services to these individualized pillars.
Are there still some gaps that you need to be focused on? Because I know that those 4 pillars will focus on necessary things for primary care, for acute care. But are there still some things that needs to be done? Because 4 pillars instead of one HS, one HS pillar separating to 4. Are there still some?
So there were gaps under Alberta Health Services, and while Alberta Health Services often took the lens of, the main door that people walked through was the emergency room door, now that we're able to focus on, say, primary care, a wellness approach. How do we keep people out of hospital? How do we attach every Albertan to a primary care provider? It's the work that we did on the primary care compensation model for physicians, having a better compensation model for our family doctors and rural generalists so that they'll, stay in Alberta, but we can attract others. It's the nurse practitioner programming, expanding the ability for nurse practitioners to take on their own panel of patients. It's the ability to solve the issue with our rural, not just rural, but rural remote, as well as medical residents. We were able to resolve their contract issues, but also provide bursary programs so that we can entice rural and remote medical residents to practice in our rural communities, because where we see some really strong gaps is in our rural remote communities. So how do we address that? How do we keep our rural ERs open? Because we see some issues there. And slowly we are making progress in all those areas. But we have to have that focused attention, and that's part of what happens through these pillars.
Lisa, go ahead.
Thanks, Madison. Minister, I'm looking back to when nurses were lifted and shifted into Recovery Alberta, and it was a bit of a bumpy road with the UNA. There was a lot of negotiation that had to happen there with their contract and all their unionized employees. So I'm wondering if you have had any specific consultations with the unions that would be affected by this particular staffing shift that this bill is doing. Have you consulted ahead of time with those unions, and what's your interpretation of their response?
So we have a process we have to go through, and we have, it's contractual, so we have to follow the process that we go through. Those unions will be notified as per the process and have been notified as per the process. We're going to continue to work with them and the people that are affected, because there's also choice for the individuals who are moving. They can choose to move or not move. That happened in Recovery Alberta. That's happened in the other moves as well. We've seen the vast majority. I don't want to say it's a very high percentage have chosen to move, and with every move that we've made, we've learned more, and we've been able to work more effectively with the unions and the representatives to make sure that these are smooth transitions, because it's always hard to change, and so we want to make sure that we respect our healthcare professionals and make it as seamless as possible.
And I am trying to get a better idea of the scope of how many people will be affected, but I will patiently wait for that answer. But I don't think this was asked this morning in the tech briefing, but what is the overall timeline here? If this bill passes, do we need to wait 6 months for regulations, or when are these people going to be moved to a new employer?
Well, that's all part of the discussion and the negotiations with the unions and the individuals themselves. It also will rely on how quickly the other pieces, can be set up, et cetera. Our anticipation is that by fall, we will have this in place. But again, that we have to be flexible with our timelines, because it is people's lives that are affected here. So, yeah, we want to be thoughtful about it.
Okay, thank you. Yeah, you can go ahead.
Thank you. I want to go back to the first question about just all the medical officers that will now be moved under Alberta Health. So we had critics like NDP, we had health policy experts that wondered if the former chief medical officer of health had been limited to speak out being under Alberta Health. So what would you say to that, and now to the fact that we have all of the local medical officers moving under Alberta Health, do protocols for them change up?
Well, I would say that working with the Chief Medical Officer of Health, they had the ability, Dr. Jaffe had the ability to, he was able to put out the information. He worked very closely with the medical officers of health in the local areas. We still do not have a provincial outbreak of measles. We have very localized areas of measles. Like when we look at the numbers, we still have only 5 identified cases in all of Edmonton zone and in all of Calgary zone, and that's since the measles outbreak started in early March. Dr. Jaffe, as well as the current interim CMOH, Dr. Sukram, have the ability to have ongoing conversations and work closely with those MOHs and those local communities, because it's very important to develop relationships with those individuals and communities that are under-immunized or unimmunized, because that is what measles is affecting the most. We continue to expand our reach across the province in terms of social media. We've got the website. We've had increased under the guidance of Dr. Jaffe when he was in the role, and now Dr. Sukram in his role, increased immunization clinics in those hotspot areas. We're continuing to really take this very seriously because, of course, it can have serious repercussions. So I would say knowing that the MOHs, the medical officers of health, that are within Alberta Health Services right now, when Alberta Health Services is no longer trying to do everything for everyone across the whole healthcare system, and because they are not in Primary Care Alberta, Recovery Alberta, or Assisted Living Alberta, they are going to be a service provider only. It doesn't make sense to have the MOHs just within Alberta Health Services. They have to take on that broader role of making sure that they can address public health issues across the whole healthcare continuum. And therefore, they currently report up to the CMOH. It's just now physically they will be with the CMOH. So it only really makes sense.
Just for my follow-up, I believe last year when we talked about the restructuring entities for divisions, the total cost was about $85 million. Has that changed in the last year?
No, it hasn't changed any. In fact, my understanding is we're still under budget on that. But once we have the refocusing fully complete, then we will have a further accounting of that, and we can share that with you.
Where are we at with the CMOH search?
We're continuing to search, really in the initial stages. As I said numerous times over the last number of weeks, we had been in negotiations to extend the contract for Dr. Jaffe. That had actually been extended for a short time period for a couple of weeks as those negotiations were ongoing. He chose to go in a different direction, but we are now in a search for the CMOH.
What's your timeline to have a permanent one in place?
Well, I would love to see a permanent CMOH as soon as possible. But again, we will have to go out to market, an RFP, et cetera, et cetera. So there's a process for that as well.
Okay, thank you, everyone. We'll now move to the phones. Operator, if you can please put through our first caller.
If you wish to ask a question, please press *1.
Do we have anyone on the lines, operator?
No one is queued up yet. We do have our first question now from Jennifer Lee from CBC News. Your line is now open.
Hi, thanks for taking my question. It's just a follow-up to the Chief Medical Officer of Health search. I guess I'm wondering, Minister, given all the concerns that have been raised by physicians in the province that perhaps Dr. Jaffe wasn't able to speak publicly about the measles situation, and given the severity of the measles situation and the concern around the spread of measles in the province, how concerned are you that you don't have a permanent Chief Medical Officer of Health in place, and what challenges does that pose, do you think?
Well, from the beginning, it's the local MOHs that are in the communities, that are on the ground working with those communities that are most affected. They report up to the CMOH, so there's obviously a lot of interaction that happens, and the CMOH has a group of people around him or her. It's not just one individual. Yes, they are the CMOH, but they also have a further group of individuals that they tap into. So I'm very confident that we have excellent MOHs, medical officers of health, and a healthcare, a public health team that is working on this to make sure that we are, in fact, I think it's because of the great work that they're doing that we've seen a 66% increase in the number of immunizations from this time last year. So last year, there was roughly about 17,000 immunizations. This year, we're well over 27,000. the word is getting out. They're also going out and putting materials out and talking to people in various languages. Sometimes there's a language barrier. So we now, I believe, have the information translated into at least 14 languages to make sure that it is going out to the people and the communities that need it most. This is not new to them. This is something that happens on a regular basis. They interact. But again, it's all about relationships. How do you build those trusting relationships? As a mother of 7 myself, I know that the relationship I had with the public health nurses when I went in to take my children in for their immunizations and have conversations about, different things that were going on, that information was invaluable. So strengthening public health is very, very important to me, as well as to all of the public health team that we have around us.
Do you have a follow-up?
I do, thank you. Yeah, so I've heard concerns from experts in public health in that area that it may be difficult to find a replacement, given the concerns that have been raised around what Dr. Jaffe was and wasn't allowed to do in terms of addressing the measles outbreak publicly. Can you give me a sense of how much interest the government has seen in this position, how many candidates you may have interviewed, and do you think you will be able to find a replacement soon?
Well, we're at the initial stages of the search. As I said, we were quite hopeful that Dr. Jaffe would have extended his contract. Since that hasn't happened, we're just at the initial stages of the search, and I'll keep you posted as we go along this road.
Okay, thank you, Minister. Operator, please put through the next caller.
We don't have any questions at this moment.
Okay, so we have time for one more question. Lisa, you can ask.
Hey, sorry, really off topic, but I don't expect you can answer this, but maybe you will. Did the government or Alberta Health Services offer a settlement to Athana Mensalapolis before that lawsuit moved into the courts?
You're right, I cannot answer that. It is before the courts, so I'm afraid I can't answer that.
Did you say no to Dr. Jaffe, anything he asked for, with respect to how the government was responding to the measles outbreak? Did he ever ask you anything that you were like, if your office said no to?
Dr. Jaffe and I had many conversations on how do we reach the people that are the most affected. And without singling out any particular group, there are some groups that are the challenge is to get to the right information to those groups in a way that, they would accept it. So again, how do we do that? Those were the conversations we were having. He wanted to do an op-ed. We supported that. He wanted to, do the U of A. We supported that. So the conversations were really, how do we get the information to the groups that need to hear it and that will have an impact. And those are the conversations he was having with the local MOHs that were going into communities and into affected groups and communities that needed to hear that. I would say that, working with Dr. Jaffe, like, he was always great to work with. And I wish him the best in everything he's going to do in the future.
But he did those things after he quit. He didn't need your blessing to do an op-ed.
He was already, those were discussions we already had ahead of time. It is still we are not at a provincial outbreak currently. There are hot spots, but we do not have a provincial outbreak of measles. Yeah.
Okay, thank you, everyone. We're going to end it there for today.